This is kind of the second week we do these live sessions as the AUB Atlanta chapter. You know, we have other events planned weekly. So hopefully next week we have a yoga session, and then we're working on other topics. So stay on the lookout for emails from us. We welcome your ideas as well for what you would like us to present. And also if any of you, you know, has a topic that they would like to present on, please reach out to the Atlanta AUB chapter. I'd like to just thank Justin Tessier from our AUB New York office. AUB New York have facilitated all these events for us, and we thank them for their support. I'm going to introduce Rola for those of you who don't know her. Rola is a member of our local chapter. She's an active member of the community in Atlanta. We're lucky to have her with us on the chapter, and we thank her for presenting this session. Rola has a bachelor from AUB and in public administration and political science, also as a diploma with educational management and leadership. In Atlanta, she has received a master's in public health from Georgia State, and she has worked as a consultant and specialist at the CDC for more than 6 years. She worked on a number of projects, including areas of global health. So we welcome Rola. We're keeping everyone on mute, not because we don't want you to hear you speak, but because of the background feedback noise. Please feel free on your app to, in the participants window, hit either the raise hand symbol or use the chat box to type a question, or you're welcome as well to unmute yourself at any moment and just converse with Rola. So Rola, the floor is yours.
Okay, hi everyone. I am really very happy to do this talk. I am very overwhelmed from the support from all of you, and mainly from the Atlanta Alumni Chapter and from friends and family all over Lebanon and the United States. I appreciate the opportunity, and I hope I can be of help during this difficult time. So I wanted to talk today about mental health in Corona times, why it's so important and what we can do about it. So I want to talk first about what we are experiencing. So it is time of personal and collective trauma. This pandemic is an unprecedented event that has caused a significant spike in anxiety and in depression. So feelings of depression, anxiety, hopelessness, anger, sadness are all normal. Additionally, there are individuals who are also experiencing post-traumatic stress disorders, especially those who have been quarantined. A recent poll by the Kaiser Family Foundation conducted from March 31st, 25th to 30th has found that 45% of adults say that the pandemic has affected their mental health, and 19% say it has had a major impact. The rates are slightly higher for women, for Hispanic people, and for the Black adults. The poll make one thing clear. If you are scared, anxious, and depressed, struggling to sleep through the night, or just on edge, you are not alone. You may be taking care of your children, you may be taking care of your parents, dealing with financial stresses, and adjusting to a new way of life. We are all adjusting to new realities, and we are grieving loss of old ones. I go here to the slide. It talks about anxiety and depression in general. So anxiety, the take of it is it's worried thoughts and a lot of emotions, but it can manifest physically. It can manifest in things like increased blood pressure, sweating, trembling, dizziness, chest pain, rapid heartbeats. And we have to talk about depression too, which is more than just sadness. Depression is people that are facing depression are experiencing lack of interest and pleasure in daily activities, significant weight loss or gain, insomnia or excessive sleeping, lack of energy, inability to concentrate, feelings of worthlessness, excessive guilt, and even recurring thoughts of suicide and death. Depression is the most common mental disorder. Fortunately, it is treatable with a combination of therapy and antidepressants. How we are dealing with stress, anxiety, and grief during COVID-19. So first we have anxiety about our health and our family's health. Then we have anxiety about what's happening to society, the economy, friends and relatives. But there's a tremendous amount of grief. We have all lost our normal day-to-day interactions and our ability to physically connect with people. And thus we have lost our sense of certainty and self-power. These feelings, again, are very normal because it is a time of personal and collective trauma. According to the American Psychological Association, what we can do about it, we can seek the right kind of social support. Because social isolation increases the risk of depression, we have to try to seek support. But we have to also be mindful not to spend too much time discussing problems with friends, which can actually increase depression as well. Exercise helps your psyche stay fit, and it's a cost-effective treatment for depression. What we also can do about it, it's important to talk about your feelings and talk about what you are going through, and not trying to be tough and you push it under the rug. And you hear from others what they are going through. Focus on facts versus rumors. And it's important to set time aside from social media, the news, and limit your sources of information to maybe 1 or 2 trustable sources. Take care of your body. You can do breathing exercises, do yoga, take naps, regular meals. In these stressful times, people tend to increase use of alcohol, tobacco, and other drugs. So be mindful of your alcohol intake and other substances. And it's important to connect with others. So reach out to others, phone calls, emails, text, even letters, Zoom meetings, book clubs, volunteer remotely. Altruistic behavior can make you feel better. Donations, virtual social connection, whether it's a weekly happy online hour or even joining support groups. More ways to dealing with anxiety. In order to stay self-aware and in control of your feelings in this emotionally charged situation, you can practice something called self-distancing. So you find ways to create space between yourself and your emotions. Research has shown that when people imagine a friend going through a tough situation, their ability to appraise the situation wisely and accurately is much better than when they think of themselves of being in that same situation. So pretend that you're thinking about a friend rather than yourself, and provide yourself with the clarity and insight about what to do in a tricky situation. Another tip is journaling. Write down your fears either on a piece of paper or on a computer. Just the act of writing them down and stepping away from them can really help you. Number 1, crystallize what your concerns are, and then number 2, leave them behind on the paper or on the computer. Try to practice mindfulness and meditation. And there are lots of apps out there that we can talk about. Other things, you can come up with coping statements, things that can help you through dark moments. This may be something like, I can take this one day at a time, or this is frightening, but I can handle it. Little sticky notes maybe around your house that can help you, a mantra that you can choose every day. You also have to remember, most importantly, to practice self-compassion. One of the key ways to becoming more resilient is to practice compassion both towards ourselves as well as towards others. And one of the keys to doing so is to interrupt the recurrent cycle of negative inner dialogue. We have to remember that kids are feeling anxious too. So watch for behavioral changes in your child. Not all children are going to respond to stress in the same way. So there may be excessive crying in younger children, returning to behaviors they have outgrown, excessive worry or sadness, unhealthy eating habits, poor school performances, difficulty with concentration, avoidance of activity they once enjoyed, unexplained headaches and pains, and last, use of alcohol and tobacco. How you can help as a parent is talk to your child or teens about the COVID outbreak. Find out what's bothering them. Check in with them emotionally. Help them name their feelings, something kids really need. Parents can talk more about their own emotional states and how they are managing their feelings, reassuring and answering their question correctly as honestly, and share facts about COVID-19 in a way that your child can understand. Reassure your children that they are safe. Let them know it's okay to feel upset. It's okay to feel anxious and worried and angry and sad and yes, sometimes happy without feeling guilty about it. Share with them how you deal with your own stress so they can learn how to cope from you. Talk about mistakes, embarrassments, shame, disappointment, regret. It's an emotional language that they need to learn from our modeling it at dinner tables or in other places. But it's also a sense of vulnerability that they need to see. And limit your family's exposure to news coverage because children may misinterpret what they hear and can be frightened about something they don't understand. Try to keep up regular routines, keeping a schedule for fun and learning activities, and be a role model. Take breaks, get plenty of sleep, exercise, eat well, connect with your friends and family. How to recognize the signs that you may need help. If you can't get your work done, if you're withdrawing from people, if you're having trouble sleeping, if you have change in appetite, change in physical energy, starting to become irritable or angry, reach out to a friend or a professional. There's plenty of telehealth sessions going on right now. You may also want to reach out for your primary care physician and ask if medication is right for you. There are some helplines that I've posted here for those experiencing distress. The Substance Abuse and Mental Health Service Administration has a disaster distress helpline. For those of us who are really struggling and thinking about hurting themselves, there's a National Suicide Prevention line. But I want to think about how this COVID is gonna be helpful for us. So despite the anxiety and the grief and all the stress we are going through, we might somehow learn something pretty significant about ourselves during this pandemic. One thing we know is that resilience isn't necessarily something we already have. It's something that we learn, that people learn through going through challenging times and rising to the occasion. For many of us, this is an opportunity to learn more about ourselves and how we can grow as human beings, as fathers, as mothers, as sisters, as daughters, as sons. This is an opportunity to prove that we can respond to an emergency like this in a thoughtful way, in a caring way that contribute to improving the situation for all of us. We can focus on things that in our daily rush of business as usual, we tend to neglect. Questions like, what are we here for? What is the meaning of all of this? What is our responsibility to try to make a world a better place? So yes, it's a stressful time. It's full of grief and sorrow, but maybe there's a way in which we can gain something to carry forward. I've put additional resources here. There's a lot of online university courses going on, Yale, Harvard, free courses at Harvard. There's a lot of online references, Kindle books, YouTube guided meditation and yoga videos, and apps There's also, like we mentioned, the online yoga session coming up next Friday at Friday, May 8th at 5 p.m. And there are books about how to deal with anxiety as well. So I just want to leave you with a positive note that yes, again, it is a stressful time, but maybe we can take the time to reflect and think and maybe learn a new skill or learn a new hobby or just invest in ourselves. So by the time this pandemic is over, we have gained something to improve our lives and other people's lives. Thank you, everyone. Thanks for tuning in. If you have any questions, go ahead.
Thank you, Rola. That was very, very informative. Thank you, Habibti.
Thank you for joining.
Thank you, Rola. Sorry, I joined a bit late.
Thank you, Rola.
You're welcome, guys. Thank you for joining me. And I hope it was informative.
It was very informative. It was a wonderful talk, Anjad. No, most of us are dealing with at least a few of the things that you mentioned. So I know for me, it really touched on a lot of things, and it's really helped. You know, you've talked to me on the side about things to do, and they really are powerful and make a big difference. Talking to people, taking time for yourself. So I really appreciate it.
You're welcome. And it's very important to take this one day at a time and not to think too far ahead. Just take it one step at a time. I think the little mantras, if some of you do yoga, really help, like affirmations, you know, I am strong, I can do this. Things like that help you throughout your day. And let's just take it day by day.
Thank you, Rola. These are very useful tools.
Yeah, they are
One other thing,
You're so welcome.
One other thing, Rola, I read a few days ago, and I'm sure others may have as well, you know, that the idea that we're all in this together, kind of we're, you know, riding this storm, but just remember also that we're all riding different boats, and the situation of every person is different. So people, you know, we're fortunate, many of us, to be able to work from home. Others are not. Many of you know, us and our friends, we know they're still going to hospitals or going to basic essential jobs. So it's also being considerate to others as well in this situation, remembering our own, you know, fortunes, right? What we're fortunate in.
It's very true. Gratefulness is very important at this time, just to remember how blessed we are to have, you know, our health, to, you know, to be able to wake up each morning and do the things that we enjoy with the people that we love. You know, everybody's going through different things. People are losing their jobs, people having financial problems, people are losing loved ones. So it's definitely a time of grief, but we also have to try to see the positive in this so we can keep going and use this downtime to maybe connect more with our kids or our family or ourselves, you know, read more books, do more art, whatever makes us happy. I mean, it's time to be a little bit selfish and just not worry about always being productive. I read this article. There's also always this rush and stress of do more things. It's okay if you have an unproductive day. As long as you're okay and not stressed and doing fine, it's totally fine. Take a nap. You want to take a nap? Take a nap. If that helps you, good for you. If you want to take a walk, take a walk. Just be true to yourself and honor your needs, and don't ignore the symptoms. If you feel like you are struggling, try to talk to somebody. Try to get help, because it is a difficult time and everybody is struggling in their own way. And it's not shameful. For me, I feel like it's not something to be ashamed of. It's something to really be honest about yourself with and say, okay, I am not doing well. What can I do today to help myself?
Rola, I I have another question or just comment. What's your advice? I mean, we all are clinging to hope and want, to hear good news, right? But there's a lot of uncertainty about the length of time, what does return to normal mean? And, so kind of what's an advice you can give us about, that balance of hoping versus being maybe realistic that we don't know what's going to happen. We don't know if kids are going to come back to school in a normal way in the fall and all of that stuff.
So I feel like I was talking to Jamila the other day that if we're gonna keep talking about the future and worrying about the future, this is where anxiety lives. There's a book called The Power of Now, which Fida had recommended to me. So it says that if we're gonna keep living in the future, we're always gonna be anxious. If we're gonna live in the past, we're always gonna be depressed. So you have to live in the now. Try to focus on today. Today is guaranteed. Tomorrow, nobody knows what's gonna happen anyway. And maybe the way we think about normal is not the same thing that normal is gonna be in the next few months. And the nice thing about like human nature is we're very adaptable. Like in the beginning of this quarantine, I feel like everybody struggled the first 2 weeks, but now everybody has a new routine. Even the kids have a new routine, and everybody is resilient and has, been flexible and has adapted. So human nature will adapt. And I think you have to sometimes believe that you have it in you and that you can cross this bridge once you get to it. Like, you don't have to worry about, because half of the things sometimes you worry about don't even materialize. So just try to live in the now and see, today, what you can do, what you can enjoy, what you can learn, what you can teach your kids. And tomorrow is never promised anyway.
Hi, Rola. It's Justin from the New York office. I want to thank you so much for doing this. This is really important this time.
Pleasure.
And I know a lot of people in the Atlanta community are involved in healthcare and public health, and they're at the hospitals on the front lines. And I know here in New York, we've had some incidences of frontline workers being overwhelmed, and even one sort of notable case of suicide. And I personally just want to say thank you to all the people there that are on the front lines and have to deal with this crisis very viscerally and on the front lines. And I don't know if there's anything different that they should be doing as they're sort of, directly part of this crisis.
Yeah. Unfortunately, I've witnessed people being in healthcare, attending to other people's needs more than they tend to their own needs. And then they are the victims of burnout and, no sleep deprivation, and severe depression, to the point of suicide. There was this article about this ER physician who saved so many people but ended up committing suicide. So that's the importance of tuning into yourself and thinking about your own needs, like I said, and thinking, okay, today, did I get my lunch? Did I drink my water? Did I get enough sleep? Can I practice some breathing on my own? Can I get 1 hour to myself? Am I so depressed that I'm drinking too much in the night? Do I need to talk to a therapist? Can somebody refer me a therapist? Will a conversation with a friend be enough? Will an art therapy help me? Like, it's about tuning in and not ignoring the signs, because people think, okay, I've eaten, I've done, I'm okay. But no, the emotional needs are a different level of needs. And people need to acknowledge when they're feeling stressed and depressed and anxious, and see how much that's affecting their functioning. If it's affecting their eating, like I said, their sleeping, their functioning, then it's time to move on to talking to your primary care, talking to your therapist, maybe taking some medication, because it is hard time, and sometimes you want to control your feelings, but sometimes you're not able to control that anxiety, and you may need a medication to help you with that. So, but being honest about it is the key. Just tune into your own emotional needs.
Thank you, Rola. I think that's excellent, because I just came off service and I was like fatigued and tired and trying to take a break this weekend for myself. But one note is, I know that Headspace, the app for meditation, has given access to all healthcare workers for 1 year for free. I haven't used it yet. I hope I can use it, but that's something also we can.
I've used the app called Calm for my daughter's anxiety, and it has breathing exercises which really helped her, you know, through her anxiety, even that was before COVID-19. But breathing is very important. We forget to breathe most of the time, especially when we're overworked and stressed. And it's very important to do all these inhales and exhales. And this is why yoga is so important in these difficult times. So I encourage everyone to attend the online session, and if they can, there's a lot of videos, like I said, on YouTube, and there's Core Power. Yoga will help you with the breathing and will help you lessen the anxiety. And for the healthcare people, like, you know, we have so much empathy for you guys. You are working, you know, 24/7. You're trying to keep us safe, but we want to keep you safe, and we want to try to also tell you thank you, and please take care of yourselves so you can take care of others.
Thank you, Rola. I don't know if Justin, are you leading the questions, or are there other questions that came through the chat?
Nothing but praise and thankfulness in the chat. So.
Thank you, guys, for giving me this opportunity. I hope you all stay well and safe and sound, and everybody take care of themselves.